I did it. I finished training in obstetrics and gynecology, and I am relieved. Everyone's been asking me, how does it feel? It feels great. This is something I've been working towards for 20 years. It's actually ridiculous. I remember being 17 in my sixth form library, being obsessed with Grey's Anatomy, and especially loving the character of Madison Montgomery Shepherd. So she was an obstetrics and gynecology doctor, but she was like double board certified, and there was this whole thing about it in where she could do like maternal and fetal surgery. And I just really loved the cases that would come up. So cases around having a postpartum hemorrhage, or delivering a woman really quickly, or diagnosing preeclampsia. And I'd be watching and guessing and really getting into it. So soon after that, I guess with that obsession, I was like, that's definitely what I want to do, be a doctor for women. Who wouldn't want to do that? So that's literally what I then spent the next 20 years of my life gearing towards. So I remember being in the library, looking at the entry criteria for medicine, but then also what postgraduate training for obstetrics and gynecology would be. And being a forward thinker, a planner, a researcher, like that was like my bag. It's just like really figuring out what I needed to do to get from there to here. I actually can't believe I'm here. When I started med school, I knew that as much as I really wanted to serve women as a doctor, I also wanted to be a mum. Like I really wanted to be a present mum, a homemaker, a wife, like all of those things. Like I just really felt that was something I wanted. And I don't know till this day if that's like societal pressure or being brought up Nigerian, being brought up in the church. Like I still don't really know if that's what has motivated that part of me. But I also was brought up to be a hard worker. Like my dad constantly work hard, go to school, get a good job. That was like the thing that we were told growing up. So I knew I wanted to be a hard worker. I knew I wanted to be a boss, right? And so I've got 4 sisters, there's 5 of us, all of us girls. And again, growing up in that culture, there was very much a, oh my gosh, you don't have a boy, oh, poor you. And I'd constantly be like, what's wrong with girls? Who runs the world? Girls. What's wrong with us? We could do anything. And if you were to see my sisters, they literally have done anything. Like they're so impressive. And I think it's just constantly lit a fire under our bottom, in our belly, to go hard or go home. And that was like the motto I carried with me. So when I went to med school and I was like, oh, should I be a GP? Nothing against GPs, but I just felt it could give me a better work-life balance, or do I want to do obs and gynae? And it was like, thought about it maybe for like a month, and I was like, nah, obs and gynae all the way. And I was very much gung-ho, it has to be this. And every research project, every audit, every special study module, it was so I could become an obstetrics and gynecology doctor. That was it. That was my calling in life. I did a master's whilst I was at med school to learn more about it. And it was like women's health, reproductive science. And I loved it. Like the fact that there was research about certain things about how our bodies work, and the fact that there wasn't enough research, like that's constantly fascinated me. And I think I've had so many things in my life that have just made this feel like the perfect job for me. I had severe period pain growing up, and every period, the first 1 or 2 days, it'd be off from school. And I'd go into school skipping, happy as Larry, and I'd be going home with paracetamol or water bottle, curled up on the couch, vomiting nonstop. And like, I literally lived my life like that from the ages of 15, probably to about 24. And when I knew that I was going to go into like the hospital and have a proper job and couldn't actually have those days off or miss 13 days a year from work, that's probably when I sought more help. And not to say I didn't seek it as a younger adult, but I just never really got anything definitive, and you know how the story goes. But knowing that had happened to me, and I was like, I'm now in a prime position to figure out why this happens, why women are tormented every month and you're missing 12 to 13 days of the year just in pain. That's madness to me. So all of those little things combined literally made me want to do obstetrics and gynecology, made me obsessed with the study of women and how we could make women's health better. And then I started working in obs and gynae. So I've done the research, I've been fascinated, I've been mentored via a TV fictional character. And then I go into the workplace, and working in my first year in a really busy unit, I was so excited because I'm like, yes, I'm going to get my hands dirty. I'm going to get into it. I'm going to do the things, right? And I would say at this point that going into the specialty, when I was doing my master's, I was very aware that the specialty really does split down the line between obstetrics and gynecology. And so obstetrics is where you're looking after mums, babies, delivering babies, maternal care around that period in life. And gynecology is like looking after women cradle to grave. So dealing with like adolescent problems that are gynecological, dealing with period problems, menopause, fibroids, endometriosis, all the shebang, everything that's women related that's outside of pregnancy, and obstetrics is like pregnancy related. And I felt that I wanted to do the obstetric side, the pregnancy side. That was the bit that I found the most exciting, and definitely like on the shop floor would be the most adrenaline inducing for me anyway. So once I got into the practice, I would say that probably still remained true, that I was probably more obstetrics aligned than gynecology aligned in terms of my interest. I love the fact that I worked in a busy unit, I'm not gonna lie. But like all the thrill and the excitement that you get when you're studying something and researching something and seeing all the potential possibilities versus the practice of something and the rigidity of the guideline and the limitations of the NHS, and not necessarily feeling that you're giving women a good go, I think weighed me down. So definitely in the first year, I was a bit like, oh, this isn't quite scratching the itch, right? But it was my first year of training. I didn't really know as much. And I was also pregnant, going off on maternity leave. And then when I had the baby, those sort of feelings of, but I want to be a present mum, came up again. And that hadn't come up for me since like first year med school. And it was just like the thought of like, leaving my child, leaving them in nursery, going to work and not necessarily seeing them as much. It weighed on me, but like also I must say when I was in the workplace, that like work hard mentality would just switch on and I'd give it my all. So I was really trying to be present at work as well as being present at home. And I do think to an extent I figured out in the early years where to draw the line. And then when I became a registrar and I was actually in the thick of it, doing it, I had a few incidences at work that again made me slightly disillusioned, made me feel unsure really if this was for me. But it was COVID and it was also distracting and it was more just about survival that I just persevered. But it was really at that point in the earlier years, I was like, actually, I do want to do this, but I don't want to do it like this. I do want to serve women. I definitely want women to have better obstetric care, gynecological care, all of these things. But I don't think I want to do it like this. And something also that I realized in practice is that when you're in med school, especially medical school in London, I was luckily surrounded by other Black doctors or doctors in training. And everywhere I've worked, I must say I've been lucky that I've always had a Black female doctor that I've worked with. I don't think I've ever been in a unit where I've been the only Black person there. And you might be like, oh, who cares about that? But it is so comforting to know that when you go through things at work that you're not the only one. The flip side is like working with other Black women has meant that for a lot of my career, I often get mixed up with the other Black female doctor. Sometimes as far as like documentation and all of those things. The reason why I brought that up is that what I noticed in practice, especially working in and around London, all of that side, where the population you serve are Black and brown women, is how different their care is compared to women who are white, especially when the consultant body don't look like the patients they're serving. That was definitely something that came up for me in practice and something that I became quite passionate about. And definitely like 2021 was doing a lot of work around that. And that was like scratching the itch and making me feel like I was actually making a difference and doing things with like my expertise and my interest area that was bigger than me. But then as life gets bogged down, you have more kids, you do exams, and I have felt that I've constantly questioned, am I supposed to be doing it like this? And I know I started the video being like, yes, I finished, I'm happy, I'm excited, I am. I really am excited because it feels like a completion of sorts, really, of a chapter of something that I have pursued for so long. But then the question I'm left with now is like, what is next? Like my path before me is really either fixed or completely unfixed. And I say that in the sense that if it's fixed, I go on and get a consultant job and I live happily ever after as I skip into the sunshine with a rainbow above my head, or I like address the questions that I have and I address the interests that I have and I think about how can I make this career work for me. Like this channel is about me as a mother, as a doctor, and as someone who's trying to live intentionally. So how can I make that be my motto in real life? And if you've watched this far, you might be thinking like, what's this got to do with me? And I think it's more hoping that my honesty triggers thoughts and decisions in you. Like, I imagine you're watching this because you are a doctor, maybe an obstetrics and gynecology doctor, and you're figuring out what you should be doing with your life or with your career. And that's what I would hope that you would get on this channel. As I'm taking bold steps into a new season of life, like a completely unplanned season of life, like I'd planned up till this point, and from here on out, I'm a bit like, don't know what's happening next. I'm gonna detail that here. I'm gonna detail on this channel what my thought processes are, what I'm trying, what I've learned, what I would do different. Like doing my postgraduate exams on maternity leave. Would I do that differently? What did I learn from that? How is that beneficial to someone else who might be watching? Yeah, that's what I'm hoping to do on this channel moving forward. What am I going to do in my life moving forward? Remains to be seen. I know that I love women's health. That is the bit that is non-negotiable for me. And whatever I do moving forward will have that involved. I have enjoyed clinical medicine, but where I think that fits in my life in the future remains to be seen, because I also want to live life. And I think that the downsides of clinical medicine is the toll it takes on you both physically and mentally. And like, I'm graying at a rate that's faster than my siblings, and I can only blame it on the job, or maybe my like internal stress levels, who knows. The world is now my oyster, right? So what am I going to do next? The only way I'm going to figure out, and the only way you're going to know, is if you watch the next few videos that come up as I figure out what steps I'll be doing next, as well as sharing a huge amount of tips I've learned through my training and through mothering whilst also working as a doctor. So yeah, stick around.